strong interest in science and in humanity and service, and so those two marry perfectly in medicine. But of course my mom is a huge inspiration because she has been a nephrologist in Austin, recently retired for a number of years. Her name was Helen Maidment. And then my father, David Maidment, is a professor at UT and has always just provided a really strong academic ground and knowledge, and so the idea of service and science has just been in my family. We're an immigrant family. I was born in New Zealand and they came here, and we feel like part of our purpose in life is to give back. The University of Texas Health Science Center in San Antonio, and then that's where I met my husband, and I always say he dragged me out of Texas against my will, but we ended up going to Charleston, South Carolina at the Medical University of South Carolina for our internship, and ended up loving it there, loving the South, loving that area of the country, and really felt strongly about the training program that they had there. So we stayed through residency and fellowship, and I did a chief resident year there and also was an attending there for a year before we ultimately came back to Texas. That's easy. So I think in endocrinology, it's I really enjoy the longevity of the relationship you have with your patients. These aren't things that are typically fixed in one meeting, so it's something that we have a relationship with for many years moving forward. And it's also with hormones and insulin regimens and such, it's a very individualized therapy, and so it's not a one-size-fits-all by any means, and I really enjoy the creativity that offers and being able to personalize someone's care. Enjoy diabetes and diabetic care because that's a lot of what we do. I think thyroid and thyroid cancer care is very interesting, and honored to do a lot of transgender care and hormone care in that way as well. So I would say that those are the things that come to mind from the forefront, but really there's aspects of all of it that I enjoy. Well, I mean, I think in my heart I never really left. It was always just sort of an adventure to go elsewhere for a while. And I think it's important to do that because then you kind of have a different perspective on why your home is so special. But my family's here, and I always wanted to raise my children here, and I love the hill country. I love the way it smells. I love the way it looks. I love mountain biking and the atmosphere of Austin. There's just nothing like it. I pride myself on is really listening to the patient and taking my cue from them as well as like sort of what they're looking for. I don't want to give them a prescription. It's important for me to understand what they want and where they're coming from and kind of tailor my plan to that. And in that way, I think listening is probably, and taking the time to really hear the patient and what their needs are and what their concerns are, I think is important as a physician, is oftentimes to talk less and to hear more. So my husband Kevin and I have two children. We have a son named David, who's 6, and then we have a son named Peter, who's 1, and they are just as perfect as can be. So my husband and I are fairly active. We run, we've recently got back into mountain biking. I do yoga. We have family runs on the weekend where our little one bikes. Of course we cook, I read. I've recently taken sewing lessons and realized that it's really hard, but I can make an apron. So yeah, I kind of have I have a myriad of different interests. It just depends whether it's winter, fall, dark, light. We have the kids or we don't, there's something for any time of day.